Our next speaker is Toni Mazone. Toni is Don Ponick's lead nurse. In most of the events that I've been to for patients, the nursing hasn't really been discussed to a proper level. And patients are always curious and inquiring regarding how they'll be cared for and their human needs during the procedure. Well, human needs are what nurses do best. And Toni's going to talk about how the nurses at the center care for the patients. Toni?
Alrighty. Hi, everybody. My name is Toni Mazone. I am the clinical coordinator and nurse for two centers in San Diego. I work with Dr. Ponick in the Del Mar Clinic, and then also another San Diego office. My objectives today is to help you understand the treatment from a nursing perspective, maybe some things, I know you've heard from many physicians, so maybe some things that from the nursing side might be a little bit more helpful for you. How to prepare for the treatment, review the CCSVI, or how CCSVI can be diagnosed, what to expect the day of the procedure, what to expect after you've had treatment for CCSVI, recovering after treatment, and then some common nursing-related questions and concerns that I've had in dealing with patients. My background, I received a Bachelor's of Science from Point Loma Nazarene University in San Diego. I have a background in medical, surgical, and cardiac nursing, and then I've been working with American Access Care since 2008. I love my job, and I'm humbled by my patients daily and grateful for this opportunity to be a small part of this potentially large new discovery. My journey in CCSVI, I've dealt with a lot of patients, but MS patient population was very new to me. And I started working with Dr. Ponick in May of 2010 when we treated our first patient. And that patient had a great resolution, no new lesions in the last year, and this was a patient from the Hubbard Foundation. So we began working with them in the trial that Dr. Ponick just discussed with all you guys. And since then, we've treated over 350 patients. The role of the nurse in the pre-procedure process, this may occur depending on where you go. It may occur over the phone or in person during your consultation visit. The nurse is going to help review your past medical and surgical history, obtain a list of current medications and supplements that you're taking, determine if you've had any allergies to medications, and then if you have an allergy to X-ray dye, iodine, or shellfish, usually you will be required to take a medication pre-procedure to make sure you don't have any reactions. So this is important to let people know if you're traveling, we need to know before you come to us so we can properly get you pre-medicated. And then also assist the doctor in helping you understand the treatment plan and follow-up. Diagnosing CCSVI, I'm not going to go into too much detail on this because we've talked about it and you'll hear a little bit more about the ultrasound and duplex a little bit later. But three types, the MR venography, the ultrasound duplex, and the catheter venography. Biggest thing about this is that the pre-diagnostic study is still not standardized and dependent on the facility that you're going to be going to. So just you'll have to ask. MR venography shows the presence of the MS lesions. MR shows the appearance of veins better than the Doppler can, shows direction of flow and the ability to calculate the speed of flow in milliliters per second, as Dr. Hakey spoke about. And the MR can also show whether iron is accumulating abnormally and can also show the drainage from the cortex of the brain itself directly, as in the Hubbard Bold protocol that we've done. We currently have a vascular technician with us in the office that does the Zamboni ultrasound as an option for patients. And then we also are working with the Hubbards to do the MR venography, so we do both in our office. Ultrasound duplex, different than just a regular ultrasound, obviously very minimally invasive. The biggest thing I want to tell you guys is if you're trying to find a place, make sure that they do the Zamboni protocol. Ask if the technician has been trained. And again, you're going to hear a lot more about this a little bit later, so I'm not going to go into too much detail, but it can take anywhere from 20 minutes to an hour and a half to do, depending on the technician. And it is the least expensive option if you need to be paying for the procedure or paying for the diagnostic. And then the catheter venography, this is where you inject X-ray dye into the veins. And this is the way the veins are studied during the procedure, as Dr. Sclafani talked about, and it is the most invasive. Preparing for the procedure, if you're traveling and you've already had the diagnostic study, very important to make sure that you obtain a copy of your ultrasound, your MRI for your own records. Some facilities may ask that you send them there, and other facilities you can bring them with you if you're traveling, but always important, make sure you obtain a copy. Wherever you get it done, you can usually obtain a copy as long as you ask. So please remember to do that. Some facilities may require that you have lab values drawn prior to the procedure. This is a BUN and a creatinine level. It's to evaluate the function of your kidneys. It's very important because the X-ray dye is very bad for unhealthy kidneys, so we want to know that you have healthy kidneys. And this is variable per facility. Not every facility may make you do this. You don't usually need to take any time off work other than the day after the procedure maybe, and then of course if you're traveling. Preparing for the procedure, travel. The reason I put this in there is because all of our patients pretty much travel to see us. We see a lot of patients from Canada, so this was a big thing that we never really had to deal with before. All of our patients that we see, that we treat in other types of procedures, are in our area, so this was new to us. But traveling alone is not recommended. If you could bring someone, it's safest to do that. Safest not to fly 24 to 48 hours after the procedure. Requirements may be different again for different facilities. Do not plan any activities for the same day of the procedure, even if your procedure's early in the morning. We start our first procedures about 7:30 in the morning, and sometimes we're done by 9. Need to have some time to recover, and then you can go home, but we really ask that you lay low for the rest of the day, and this is to prevent any complications and bleeding from your groin puncture site. Try to find a hotel that's near the treatment center, and then make sure that there's elevator access. We ask that you do minimal stair climbing for 24 hours after the procedure. Day of the procedure, depending on where you go, you'll be asked to have nothing to eat 6 to 8 hours prior to the procedure and nothing to drink 2 hours prior to the procedure. You may take your essential medications with a sip of water, but verify with the facility that you're going to, because that can vary as well. May need to stop taking aspirin, Plavix, or Coumadin. These are anticoagulation medications, and depends on the physician preference and the facility you're going to, whether or not you're going to need to stop those. But if you are aware, good to know before you leave if you're traveling. Anxiety is a normal feeling, anticipating what is unknown. I would say almost 100% of my patients are very fearful when they come in the door, and almost all of them, when they get off the table, say that was way easier than I anticipated. The nurse will start an IV in your arm or your hand. The procedure can be performed either on the left or the right groin, as Dr. Sclafani said before, and it's the physician preference, but either is okay. You'll be monitored, your heart rate, blood pressure, and oxygenation throughout the procedure. We give you a low-dose oxygen because the medication makes you sleepy and slows your breathing down. Shaving, a lot of patients like to shave before they come and see us. It's actually not recommended, and the reason for that is because of infection. Razors actually break the skin, which is your barrier for infection, so we prefer to use a clipper. So even though you're trying to help us out, it's better if you don't shave prior to the procedure. Like Dr. Sclafani said, the lidocaine injection then in your groin area. Tell patients it feels like a stick and burn. It's usually the worst part of the procedure, and hopefully at that point you've had a little sedation medication in your system and you don't feel that. Small plastic tube is inserted into the femoral vein. Just a little bit about conscious sedation. This is what we use in our facility. As Dr. Sclafani said, there's different versions, but you'll be given a mild light sedation, sometimes called twilight sleep. This will cause you to be sleepy, easily awakened during the procedure. Dr. Ponik and our physicians do like the patients to be able to be able to take breathing instructions. So it's a light sedation, kind of doesn't really make you worry about anything, I would say, during the procedure. Kind of makes you feel like you've had a glass of wine or two. So it's a very nice medication. It's Versed, which is an anxiety medication, and fentanyl, which is a pain reliever, administered IV. If you are difficult to get an IV in and you're worried about that, you've had that problem in the past, the same medication can be given through the catheter in your groin, so please don't worry about that. You can't drink, drive, or make any important decisions 24 hours after the procedure when you're given this medication. Medications will usually wear off quickly, like I said, and everyone has a different tolerance level, so please just communicate with your nurse during the procedure on how you're feeling. If you feel like you want to be more sleepy, some patients want to actually watch the monitor and watch the procedure. We give everyone the ability to do that as much as they can, so just communicate with the nursing staff, and we'll make you as comfortable as possible. Equipment used, this is just some procedures, and I know Dr. Sclafani went over it as well. But catheters, balloons on the right-hand side, this C-arm or X-ray fluoroscopy monitor, and then the stents. Angioplasty is the treatment. Veins are variable in size. There's different size balloons. There's multiple things to consider. The biggest thing I would say when I've been speaking to patients is patients seem to compare balloon size with their friend or something like that, and thinking the bigger size balloon, the better the treatment, and that really is a false accusation. Balloons don't stay in the vein as well. Some patients think that the balloons kind of go in the vein and then stay there for a period of time. They actually go in, are inflated, and then are removed. So just some common things that I hear from patients, just to clarify in case you guys had questions in regards to that. Treatment, as far as stenting, stent is a metal tube that helps hold the vein open. It's permanent and cannot be removed without extensive surgery. It's never mandatory. Always have a clear conversation with your physician about your personal option on stents. As you know, we're still learning a lot about them, but it's always your option and your choice. So please just have a conversation with your physician. You may also need to be on blood thinners, so that's a consideration. You need to make sure that if you are traveling, that you have a primary care doctor that can kind of help monitor if you need to be on Coumadin or an anticoagulation medication. Post-treatment, the plastic tube's removed. The nurse will apply manual pressure to your groin for about 15 minutes. Dressing will be applied, and then you're asked to lie flat with your head of the bed less than 30 degrees. You can eat, drink right after the procedure, as long as you can do it laying relatively flat. And then the recovery time, depending on where you go, is anywhere from 1 to 4 hours. Some urinary concerns. This is a big one for a lot of my patients, but just some things to clarify. You are able to use the restroom immediately prior to the procedure. You can wear an incontinence pad during the procedure. We usually just kind of cut it or leave the area that we need to prep and sterilize open. It's okay to have a Foley placed prior to coming. If traveling, if a Foley catheter is better for you when you travel, then you're more than welcome to have that. We just ask that you coordinate that with your primary care or wherever you're coming from. And then during the recovery period, we can only use a bedpan or a urinal, and the nursing staff is always there to help. So please don't worry about that stuff. And then catheterization is always available if need be. And then you do have to void before you leave the office. That's a requirement that we have. Some other common concerns that I hear, I know that a lot of patients have muscle spasms, and will that interfere with your procedure? Usually it will not, and there's a few things that we can never going to permit you from having your procedure. You can take your muscle spasm medication, your baclofen, if you that's something that you take. You can take that the morning of if that helps. And then there's a few, things that we can do, but usually the sedation medication, I find that a lot of patients that have severe spasms, as soon as we give them the sedation medication, it really relaxes them, but it's never going to interfere with the procedure itself. Will the procedure be painful? Little, if any, pain during the procedure. You may feel some pressure, some burning with the angioplasty. And then a lot of patients tell me it's a very odd feeling to them, but they can actually hear the swooshing of the dye into the vein, especially when we're up high in the jugular veins. They can hear the movement of the dye in the vein. Feel the sensation of the catheter, kind of a poking feeling, but never painful. And then, of course, the pressure from the angioplasty. And then sometimes when we're doing angioplasty in the azygos vein, it's a very normal sensation to have a coughing reaction. Recovery after the treatment. MS symptoms are variable and unique to each patient, and this is what we're finding as patients are recovering from this. The experiences seem to be similar. The biggest thing I tell my patients is you know yourself and you know your body the best, and you know the things that feel different and have changed. So please inform us of that and record those changes. Resume your normal activities within a week, and you can start new exercise programs within 2 weeks. Stopping MS medications, as Dr. Ponick said, this is something that you need to discuss with your neurologist or your primary care, whoever prescribes your medications, because it's, we do not recommend that there be any changes in that. Healthy lifestyle, gluten-free diet, exercise, and rest is something that we highly recommend. There's a lot of education and stuff on that for you guys on the internet. I'm sure all you guys know, and the CCSVI Alliance is great on that. Vitamin supplements, and then a lot of patients ask me about massage and chiropractic, if it's okay to resume that. Unfortunately, there's no right or wrong answer to that. We really don't know if it affects or not, so I just say use your best judgment. And if it's something that you need for your lifestyle, then that would be something to continue 2 weeks after you've had your procedure. And then recovery after treatment, restenosis, this is that gray area, and I'm sure that there'll be a lot of discussions this weekend from the practitioners. How do we find out what's the best way? As Dr. Ponick said, the returning of your symptoms. So we tell patients that you know yourself best, you know the symptoms that have improved, and if you notice those symptoms starting to come back, please give us a call, have a discussion with your primary care, and then have a discussion with your treating physician as well. And then at that point, we'll decide on what diagnostic study is best, or just to return for the catheter venography in assumption that you're going to have more treatment that time. Just want to share one patient success story with you. This is a patient I received an email from after the procedure. Just wanted to give you an update. 6 weeks post-surgery, I can report fully restored balance, energy restored, no MS fatigue, proper bowel bladder function, major reduction in leg numbness, restored left foot movement, much increased ease in walking, that waxing and waning, yet clearer mind, stronger speech, no more anxiety, steadier emotionally, better skin color and warm feet. I still have odd times of neuropathic pain in my feet, but far less often. It used to be always. Physio is working using electrical stimulation to restore atrophied muscles in left leg. Still have to watch for foot drop later on the day. On strict gluten-free, nutrient-rich, dairy-free eating plan and taking Nepronol in addition to supplements. Such a success. Please share with concerned patients if it arises that some of the wax and wane periods can be lengthy. I lost my ability to walk well for a full week at 1 month post. Thank you for your commitment to resolving CCSVI. I have much quality of life returned to me, which returns quality of life to my family. I require rest and relaxation to consistently feel well, but I do much more than I ever could. And then one more thing, I don't read a lot of the blogs. I try to be a little less involved, and I'm very busy. But this is one that a patient turned me on to, and I believe he is here today and will speak to you guys. But I read this and really just kind of hit home for me. Getting hit with a chronic debilitating disease not only affects the person with actual diagnosis, but all of those around them as well. Family and friends all feel the concussive force of the disease, which radiates blast waves much like an atomic bomb. The patient may be at ground zero, but those in close proximity can suffer terribly also. And the closer they are, the more grievous the injuries inflicted. It's not only the patient's life that has been forever changed, but all of those who love and care about them. And this is from the Wheelchair Kamikaze, and I truly have been changed by this experience. So thank you very much for your patience, resilience, and advocacy.